My dear friend Robert Ang is going to talk about 1 year clinical outcomes of two different ablation profiles, regular and strong, with the supracore presbyopic LASIK treatment.
Good afternoon. Thank you for accepting our free paper on Supracore, which is one of the presbyopic LASIK options with the Bosch and Lomb Teneo 2 M2 laser. So I'm an investigator for many companies doing presbyopia treatment, including Bosch and Lomb. So LASIK, as we know, patients come for laser surgery, and they mean LASIK, and when they're above 40 years old, then you need to make a choice. Do I use monofocal type of LASIK and do monovision, or does my machine offer me a presbyopic LASIK option? So the Supracore is an algorithm that creates an ablation profile where the center is steeper. So the simplest way of describing it is a controlled central island in the middle, which is elevated in the central 2 millimeters and flatter in the periphery. So why is that? Because the center, when your pupil constricts for accommodation, you want to be looking in that central zone for near vision, whereas when your pupil dilates, when you look at far, you want the mid-periphery to give you the good far vision simultaneously. Okay? So over the past 10 years that I've been using this, we had one program, we call it Supracore Regular or the regular Supracore. But for the past 1 to 2 years, an innovation in an algorithm created a mild, regular, or strong. And in this study, we are comparing the regular, which we started with the new stronger program, because we wanted to know if it can give better near vision. So as you can see in the topography on the left, the Supracore Regular creates this steep zone, and the Supracore Strong creates an even steeper zone. But everything else is the same in terms of targeting and refractive outcomes. So in our study, we recruited patients. They were either myopic or hyperopic presbyopes, and we randomized them. My technique in presbyopia treatment is modified monovision, meaning I want to make sure the dominant eye is good for far. So we use ProScan treatment. The non-dominant eye will be good for near, but with good distance as well. So that gets Supracore. So the non-dominant eye in the study will either get a Supracore Regular or a Supracore Strong. That's the randomization we chose. So we have these tests and 12 months follow-up. So in terms of baseline characteristics, so 48 to 50-year-olds were included in the study. Then more females, of course, more females. Photopic, uncorrected distance vision here on the left shows that uncorrected distance vision is 0.14 or 0.16, which is about 20/25 or 20/30. And near vision, uncorrected near vision is also 20/25. So whether it's strong or regular, it gives good distance, good intermediate, uncorrected, and good near vision. Now, one of the things that are evaluated in presby-LASIK treatments is, does the algorithm cause loss of lines of vision? And because of the improved smoothness of the profile, none of the patients lost 2 lines or more. So when you have previous studies, they show that they lose 2 lines, but now no more. The focus curve shows a smooth, a continuous range of vision, and in terms of photopic and uncorrected near vision, you see this good distance, intermediate, and near vision. In terms of MRSE, the target is minus 0.5 to minus 0.75. So at 12 months, the Supracore Strong is a little more myope because of the added steepness, but 0.7 versus 0.5 in the Supracore Regular. So we are on target in terms of refractive outcomes. Now, how independent were they in terms of glasses? Distance, intermediate, and near. Near vision is about 85%. Distance vision is about 90 to 96%. So in terms of outcomes, First, our strategy of one eye distance proscan and supracore on the other eye works very well. Patients are happy, and both algorithms are showing good efficacy and satisfaction. Thank you very much.
Very nice outcomes. Any questions? Because to have such a long-term outcome, is really good.
Yes.
5 year plus in this thing. Do you have a experience with Press Beyond also?
No, usually doctors will either have one machine or the other. Rarely will somebody have two different brands. They're quite expensive.
Because what I've seen, people who practice these right technolas, they are fan of Supracore, and
Yes.
people who have Mel, they'll say, okay, press band is better.
Yes.
Both works on a dominant, non-dominant eye fashion in such a manner where distance corrected with the dominant eye and near with the non-dominant eyes.
Yes.
It seems to do well if you correctly choose your patient and counsel them appropriately.
Yes, and the dominance testing is very important. You cannot be wrong in the dominance or else.
Absolutely correct. Any regression happening in the long run in these cases?
Usually, I tell my patients that this lasts about 5 years because they will progress in terms of presbyopia. So the refraction is still the same, but now they need more reading. And when we track them over time, so I have 8 years patients already, the refraction still minus 0.5, but they became more presbyope. So the non-supracore eye became worse in terms of reading. So now they feel that, oh, I want reading glasses.
Okay. So can you add on to that some additive procedure?
Yes, we had our experience with retreatments wherein we added more minus in the supracore eye and made them -1 or -125 because that's their age. So when you're 52, 55, you need more.
Yeah. Thank you so much.
Thank you.